excited to talk to you today about a topic that can help your people now and year after year. I'm Erica Armstrong, and my background is I was a practicing family medicine physician for years when I found and trained in functional medicine and started Root. We've been working with individuals and employer-sponsored individuals for the last 2 years in a category we created called Root Cause Health Benefits. Our key takeaways today, we will discuss how addressing root causes can not only prevent conditions from getting worse or new comorbidities from developing, but it can actually start to reverse conditions like autoimmune diseases, metabolic diseases such as diabetes. And when we do this treatment at the root cause, what happens is medication dependence naturally lowers, health improves, and ultimately your costs will go down. If you're a self-funded company, you must pay attention to these 3 key areas. I have reviewed hundreds of thousands of claims for companies in our pipeline, and the CDC states that up to 90% of your costs are chronic conditions. These are the areas I'm finding that are high up there in the chronic conditions. The other thing about these conditions is that conventional medicine doesn't really have a great solution other than medications that are escalating in dose and number or procedures. The interesting thing is these conditions all share some of the same root causes, like inflammation or insulin resistance. We cannot wave the white flag here. Chronic conditions will drain your budget, your productivity, and your people. Here is a particular area where hope is not a strategy, but we will talk about a strategy that can help. 90% of your costs being chronic conditions. This is what I experienced as a primary care physician. I was this PCP in the conventional health system. And the way our system is set up is it's very siloed. You see a gastrointestinal doctor for bowel symptoms, a dermatologist for rash, a rheumatologist for joint pains. And each time that referral happens, more testing and procedures and medications rack up. At the end of the day, you might be left with 4 or 5 different meds. You're not really feeling that much better. And you bounce back to your PCP, and you and your PCP are both frustrated. I've been there. This is where Root steps in. Because we see the body as interconnected systems, we can put the whole picture together, figure out what's actually driving most of this, and work to reverse it. What is Root? We do whole body lab testing and functional medicine telehealth nationwide in the 48 continental United States. Root is clinically validated functional medicine. If you're familiar with functional medicine at all, you may know that there's a great variation in the types of practitioners and the treatments that are offered. Sometimes it's really expensive IVs or expensive supplement protocols, and in the outcomes. Our team starts with highly credentialed clinicians. Board certified MDs and DOs and dietitians work together, and we are outcomes obsessed. We track things like lab improvements and healthcare costs going down, as well as overall symptom improvement and the restoration of health and vibrancy. We're designed for people and delivered by people, but we're also a tech-enabled service company that allows us to deliver this at scale. In our Root model of care, it starts with knowing your health data. This includes whole body lab testing, where people can get their blood drawn nationwide through Quest Diagnostics, and we use the results of that to make data-driven decisions. We're looking for root causes when we start with testing, and we change the focus from simply managing disease to actually starting to reverse it at the root cause to optimize body function, and that's where the functional comes from in functional medicine. This illustration is an analogy of a typical conventional healthcare experience. Let's take acid reflux or heartburn for an example. If you go in with heartburn, you're going to likely be prescribed an acid blocker medication to kind of clean up the mess after the fact, leaving root causes unaddressed. The problems with this are multiple, but first, if we don't turn off the faucet at the root cause, other conditions can develop. For example, some root causes of heartburn could actually be too low of stomach acid, making that top valve on top of the stomach too weak so that acid comes back up. It could be an H. pylori infection that nobody has checked for in stool testing. It could be a food sensitivity, at worst celiac disease and sensitivities. We can help every single employee in your organization, but these are our main areas of expertise. Insulin resistance, prediabetes, and diabetes. Over half of US adults have this now. 40% of young adults have this, age 18 to 44. Autoimmune conditions, IBS or gut health issues, and hormonal disorders. Let's talk about how we approach gut health differently. In the conventional medicine experience, IBS or irritable bowel syndrome is a, quote, diagnosis of exclusion. That means after you've had a colonoscopy or sometimes a repeat colonoscopy with no answers, they've ruled other things out, we get labeled in a bucket called IBS, and you may be prescribed some medications to try to help. You may be handed the same generic low FODMAP diet if there's even a dietitian involved with very little follow-up. A functional medicine approach knows that IBS is actually caused by a microbiome imbalance over 85% of the time, and we test for that in a non-invasive way. Then we put people on a program, a protocol, to help heal the gut and rebalance the microbiome. We may use medication, and if we do, it's short-term in order to eliminate something that's causing issues. We have a food-first approach, and so our dietitians will look for root causes, things like food sensitivities or mealtime behavior, and they will work with people with the end goal to advance the diet so that they don't end up on this long-term restrictive diet trying to manage symptoms. How do we do all of this thorough investigation and treatment? This is our secret sauce. Our doctors have experience in the primary care, internal medicine, and family medicine fields first. That's so we know how to diagnose things that may have been missed. Also helps us be comfortable with the safety of de-prescribing medications or medication off-ramp. Then they have gone on to the Institute of Functional Medicine for training, and when they get to root, they go through our root residency to learn our proven clinical protocols. Then we have access to more data. PCPs are sometimes limited, mostly due to cost of labs, time, and the access to certain functional testing like microbiome testing. And then we're built on a technology platform that makes all of this seamless with our entire operating system in one place, leading to transparent costs that ends up saving a lot of money on visits and on labs. How this works in real life. This is a case of an autoimmune condition called rheumatoid arthritis. In many cases, people have tried multiple different medications before they end up at root. This person was taking Enbrel, which was costing a significant amount of money, but her symptoms were persisting. She had even tried natural treatments by her holistic PCP, who ultimately referred her to root. And then with our targeted doctor and dietitian support, we worked on gut health, corrected nutrient deficiencies, removed food sensitivities, and balanced her hormones that led to remission of her rheumatoid arthritis. Now, her rheumatologist did finally agree that she was in remission. This almost never happens in conventional medicine. But overall, she had saved herself or her company over $60,000 a year. And most importantly, she was feeling back to herself and able to be an involved mom of 3 boys and a productive HR leader. Step 1 of her case was a data-driven treatment plan. We start with our root cause panel, the same panel we've used in practice for 6 years as a first step, screening for the most important things that are often missed or could be tweaked so that we can find simple things to fix right off the bat. When the results come in, they are accessed on RootOS, our platform, with a simple email and a click with a full write-up from our doctors and a link to share that with any other doctors that are involved. After the root doctor interprets your labs and sends you full write-up and recommendation, you're then supported on the root platform with our resource library, live events, and our community. Some people need additional one-on-one support. This is where a real human at root reaches out and says, you should probably add a visit with a root doctor or a dietitian based on your results and the doctor's recommendations. And this is really where we move the needle for those with higher chronic conditions. Step 2, when we start working with people, is we use food as medicine after we get the right data. And so blood sugar balance is important for everyone. I already stated that over half of us have insulin resistance, but blood sugar balance is also important for energy, productivity, mood, and mental health. And we use an addition mindset, meaning what can you add to your plate as opposed to restrict? That means adding things like fiber and healthy phytonutrients that help with reducing inflammation. Our approach is realistic and sustainable because if you can't do it, it's not going to work. This is our core nutrition philosophy. This is the root plate. This works on many levels, but the first, again, is balancing blood sugar. Here you have a balance of protein, healthy fat, and fiber on your plate. This method can be done anywhere, even if you don't have a kitchen, and so it helps us meet people where they're at. We work with a lot of employees sometimes that are eating on the go in construction sites and eating at gas stations. We teach things like noticing the difference. The top picture is a typical American plate, especially if you eat a lot of takeout. You can see if we take that starch and condense it down to less than a quarter and fill up the plate with non-starchy veggies, this insulin response and then blood sugar is going to be so much better, and people will feel better right away when they start eating like this, which helps us keep them engaged. More real-life examples, our dietitians write all of our recipe guides. They love to cook. They love showing people how healthy food can be easy and tasty. The next principle at Root is that you have to understand that medication alternatives exist. We see people who have either had side effects on GLP-1s, or they lost their coverage, or they really just didn't want to go that route. And after balancing their blood sugar, we use things like berberine, NAC, and inositol that actually do treat the root cause of insulin resistance and have other protective anti-inflammatory benefits and a lot less side effects. We also teach people how, with that addition mindset, to naturally increase their GLP-1 production. And then a couple more examples there, like for headaches and gut health. These are very evidence-based things that are just not thought of in the conventional model. So how the Root program works is the entire organization is eligible to start with a root cause lab panel. And from there, based on our doctor's interpretation, most people in the organization will be able to be supported on the platform with nothing additional needed. Others will be identified as needing one-on-one support, and that's when they'll work with our doctors and dietitians via telehealth. Here's just some snapshots of the additional resources: live events with our clinicians monthly, ability to ask our dietitians questions, courses, recipe guides, even a stress retraining course, which is very important for most people. All within the app, they can schedule their doctor and dietitian visits and simply click a link to join. A year of Root does not stop after the first test. If you're in the course support, you can retest throughout the year. You can be engaged in our community, take part in challenges like our upcoming smoothie challenge. How does this work for companies? This is the first company we worked with. They were a construction company, and the owner wanted to do a pilot program. She loved functional medicine, thought it could help her people with diabetes, autoimmune conditions, and more. We always knew it had clinical results, but when we saw the financial results, we knew this was what we had to do full time. We reduced their year-over-year healthcare claims overall by 45%. Due to the success of the pilot program, they recently enrolled all 426 employees in July. Secondly, we have a manufacturing company. Now, we work with all different types of companies, but I point out these two in particular because this is actually our main areas. And so here in the first 6 months, we've already started reversing type 2 diabetes. People have lost significant amount of weight without needing GLP-1s, breaking the cycle of migraine issues, and we've shown that even just the ones who have repeated the labs, every single person who has participated has benefited. Why is this a financial no-brainer? In a typical 400-person company, we only need to have a success story in about 1 or 2% of your population to make this ROI a no-brainer. Here's some of the various ways we do that. Getting a couple of people off of autoimmune meds in your population. preventing or eliminating GLP-1 medications, reversing costly conditions. But then that bottom one is probably underestimated here, but we stop the specialist to specialist bounce around, put the picture together for people, and guide them forward. Why this makes sense for every self-funded company? It's wide enough to help your entire population, but deep enough to target your highest claimants in a very cost-effective way. It's one solution for all chronic conditions. No more need to manage multiple apps that are overwhelming and have very low engagement. You'll save money right away using our lab testing costs and our transparent doctor and dietitian visit costs. The biggest thing here is the last point. We don't want to just tack on another expense that's there recurring year after year to manage your conditions. We have an end goal in mind for every person that works with us. We want them to graduate healthier and move down to the core support level so that we can keep an eye on them long term. So thank you all. I will check the app for questions. We do have, if you'd like to learn more, we do have a podcast. It's called Get to the Root. In a recent episode, the CEO of Health Rosetta was on, Dave Chase. We also have a booth here downstairs, 125. We'd love to see you there as well. We have some little vitamin D drops and chocolate and socks and things. So I'm going to give people a minute to put questions in, and I'll check. Oh, cool. 7 questions. Okay. Okay. Just trying to pick from the 7. How can functional medicine and lifestyle medicine work better together? I want to point out that we often sit alongside a DPC. We are there to enhance it. And we get referrals from DPC practitioners, and this works really well. They just refer to us like any other specialist because we can take that deep dive and we have access to more testing and more time. Lifestyle medicine is something that is part of it. There's a great overlap there. We tend to do more personalized, deep, advanced testing protocols. How can we drive consumer demand while balancing evidence? Yes, we are clinically validated functional medicine. It is one of the reasons we exist. There's a lot of variation out there in this field. Can a member see the same doctor each time? Yes, I'm so glad for whoever asked that. It is one of the keys to our success is continuity. A lot of times, even with your primary care office these days, you are bounced around to different people in the office. And having a relationship with a doctor and a dietitian is one of the reasons that people stay engaged with us. How does Root ensure long-term success and sustainability with members? What sort of follow-up is done? So once a member is enrolled, they are typically with us for a year, whether or not they're needing to add telehealth visits. So we do follow them even if asynchronously. And through Root OS, our operating system, we're able to put in repeat lab recommendations so that they are being followed and we are being notified. No, we don't have to rewrite health plans. This can fit nicely alongside your other existing health benefits. With the enablement of telehealth for all high deductible health plans, this has really opened the door to us being flexible to just charge per use. How does it compare to Function Health? I love this question, thank you. So if you're familiar with Function Health, they are a lab testing company only. They have no clinical team. So what we have seen is people get results that are abnormal and they don't have access to care. What does that do? They end up in the ER or urgent care trying to address their lab results. That is driving up the costs. The key area where we drive down the costs is a real human reaching out and following up with people and working with them to reverse their conditions and the access that we have to our team. But we do have the same lab panel and about the same prices compared to Function Health. Okay, how can we balance social determinants of health? Yes. And so actually the people that we work with probably aren't the first type of people that you think of when you think of functional medicine. These are not just people that are in it for the wellness part of it. These are hardworking people with real challenges, real stresses. As I was mentioning, sometimes we're telling people what to choose at a gas station. And this is where our team comes in. Our dietitians have worked with people from all walks of life, from all socioeconomic classes. We are down to the last 5 minutes. And so they're very well trained in meeting people where they're at. Problem of worried well. Yeah, so the way that we have set up the program is absolutely the worried well can do their screening panel and hopefully actually be reassured or find simple things that they can work on. And they may or may not qualify to then work one-on-one with the doctors and dietitians in chronic condition care. Our dietary recs are very functional medicine based, and they are, if you look at the root plate, it's about 75% of it does come from plants, but we are protein advocates and we are healthy fat advocates. What factors have you observed that engage employers? I think there are several. I think having a community, an online community, where there are monthly live events and then real humans that actually reach out and engage, as opposed to most apps, is what helps people stay engaged. What happens if they don't follow up? We have our dietitians, our account managers, and they will literally run the list on your company. Each company has one, and they will say, oh, this person hasn't been in, this person didn't do this, and they will send messages. Are you providing food or any type of purchasing incentives? No, we don't do that, but we do make it really easy for people to find how to come up with healthy foods. How does Root integrate with current PCPs who may be functional health providers to, example, on-site health care center? Yes, similar to how some of our companies have on-site DPC, what happens is there's different ways. One, they can use our lab testing and our doctor's interpretation. They're going to save money on their lab costs. Also, we're a consultant for them. In our team of Root clinicians, we actually collaborate every week on our tough cases, so that if somebody is struggling, they have literally a team of experts, we say, rooting for them. And so we can be that extension for your on-site clinics as well. Can this be a GLP-1 strategy? Yes, and it is. Some companies have written us into their protocols where they have to work with Root as a prerequisite. We're down to 2 minutes. These are really great questions. Thank you, everyone. Okay, I think I got them all.